Victoria's here. Great.
Yes.
Hi, Victoria.
Hi, everybody. So welcome to today's BC Support Unit webinar, which will be about an hour in length. My name is Belinda Jampo, and our webinar today is entitled BC Support Unit Patient-Oriented Research Registry Data, and it will be presented to us by Brittany Schechter and Ryan Fairweather. So before we begin today's webinar, I would like to start by acknowledging the territorial and ancestral and unceded territories for whose lands we're leading today's webinar on. So that is the Squamish, Tsleil-Waututh, and Musqueam nations. So now you guys may have noticed that as you've come, you've just been made attendees for this webinar, and that's because we're using the webinar setting for this. So that means if you do have any questions for our presenters at the end of the presentation or throughout, you can ask them using the chat box or using our Q&A function. So just to let you guys also know, today's webinar is actually being recorded and will be available for dissemination on our YouTube page. So you guys can share that with your colleagues. And yeah, so that's it for me. So I'm gonna give it over to Ryan and Brittany to start today's webinar.
Thanks, Belinda. Hi, everybody. Thanks so much for joining us today and spending your lunch break with us. So we set up a little poll just to kind of see where people are coming from. And I'm gonna ask Belinda just to share that now, if she doesn't mind. So the first question is just getting a handle on where you're located, if you're in BC or if you're elsewhere. The project we're talking about today is local to BC, but the principles and everything could definitely be applicable anywhere. So, all right, so half and half, great. That's awesome. So thank you so much for coming from wherever you are. And then we've got another question here just to see who's in the room with us, in the virtual room with us. So just wondering what stakeholder group that you identify with. And if you wear more than one hat, then just pick the one that you're feeling today or the one that is your primary role. Okay, fabulous. It's great. Thanks so much, everyone, for indulging us with the poll. So I think I can exit out of this here. Okay, so yeah, as Belinda said, my name is Brittany Schechter. I am the lead for the patient-oriented research database and mapping project that we're running out of the BC Support Unit. And we're going to be talking a little bit today about the project, and the hope for this session is for us to inform you a little bit about what we're doing and where we're at so far with the project, but to also get a little bit of feedback from you if you have anything that you want to share with us or any initial thoughts about the route that we're taking so far or what you would like to see in a project like this. So we will be sharing some slides, and Ryan will be doing a presentation for us. And then we'll have lots of time at the end to take questions. And I know that this is a webinar format Zoom meeting. So unfortunately, not everyone is able to share their screen, but please enter any questions into the chat box and we will get to them at the end of the presentation. So with that said, I will pass it over to Ryan and I'll let him share his screen and start the presentation.
All right. Thank you, Brittany. Hi, everyone. Thank you all for joining us today here at this BC Support Unit webinar. I know I'm really excited to hear what everyone has to say and share with you just a little bit about our project and what we're doing here with the patient-oriented research database. So my name is Ryan Fairbrother. I'm the project coordinator here on this team working alongside Brittany. So first we'll get into a little bit about the background of the project and where the initial ask for this came. So initially this was a project that originated from patients through a project that was formerly known as the Patient-Oriented Research Mapping Project. And in this, patients identified a need for a tool that would help identify have a list or a database of some sort and a map that would help list different patient-oriented research projects that were taking place throughout the province, which they identified that could lead to a multitude of benefits. So things such as collaboration opportunities, reducing duplication amongst studies, also measuring the effectiveness of patient engagement. And one of the most important things about this project is that it was requested by patients for patients. So currently, this project has been moved to production and is supported by the BC Support Unit. And our team consists of myself as the project coordinator, Brittany, who is the project lead, Belinda, who spoke a little bit earlier, who is our project manager, and our two patient partners, who are Swapnil and Paul, who are providing expertise and oversight on this. So we're hoping by the end of this project, and once this resource has been created, that this mapping database project becomes a public-facing, easy-to-use resource that helps identify existing patient-oriented research projects and organizations that are actually conducting patient-oriented research all throughout the province, which would hopefully allow for increased collaboration between patients, unit staff, and organizations. So first and foremost, what is patient-oriented research? So patient-oriented research is research done in partnership with patients that aims to answer questions and outcomes that matter to patients and ultimately improve healthcare. And these patients are involved as research partners on a multidisciplinary team and work to identify patient-oriented priorities and outcomes. And patients are actually those with lived experience of a specific health issue, which also includes caregivers of these individuals, such as their family and friends. Brittany, if you'd like to speak about the IAP2 scale, if that's okay.
Sure. So we just wanted to put this up here because it's a tool that we use at the support unit, and that CIHR, which is our funding body, which is the national level health research funder. It's a tool that we use to measure the level of engagement and of public participation and public engagement on research projects. So we just wanted to put this here for context for those of you that aren't familiar, just to kind of lead into the next slide where we talk about how we are actually determining which studies are patient-oriented and which ones that will be included in this database. And if anyone has questions about this, definitely let us know.
Okay, so the next piece is about inclusion criteria and what criteria that specific studies need to meet in order to actually be included within this database. So our project team came up with that one specific criteria that must be met is that a study must be classified as minimum of consult on this IAP2 public participation spectrum, and that will be determined by a BC Support Unit staff member on the back end of the database. So upon submission, a staff member would review the project submission and determine whether or not it is in fact at a level of consult. Some additional criteria that will be under consideration but not necessarily mandatory are that a project has been supported by the BC Support Unit, meaning that it's received consultation services and support from the unit or one of its various regional centers, as well as whether or not a project has received funding from a CIHR SPORE program. So these two aren't mandatory pieces, as we're also looking to hopefully capture all patient-oriented research studies and not just ones that are supported by the support unit. So some of the information that we're hoping to collect include basic project details, so the title of a project, a short description of the project, who the principal and collaborating investigators are, primary and collaborating organizations on the project, and as well as some funding information, what the research topic is about, what stage the project is in, whether or not it's a planning project, a current operating research project, or a knowledge translation implementation project, whether or not the project is affiliated with the BC Support Unit, some location details, which ties into the mapping component that we'll talk about a little bit later on in this webinar, and as well as patient engagement details, as Brittany mentioned earlier about the IAP2 framework, and as well as what we're using to determine whether or not a study is to be included in the database. So in order to do this, we came up with two measures of how we're going to measure engagement. And the first being is we're going to list how many patient partners are involved with each study. And then the second piece is we're going to connect with patient partners and researchers via a short survey to ask them about how patient partners are actually being engaged on their project. And some of our reasons behind this is that doing so, this would hopefully provide any user an in-depth look at engagement methods of each study that would be listed on this database. And as well as we're hoping that this could provide an education opportunity for anyone who's wanting to improve engagement methods or also just seeing what's being done currently within other projects. In terms of data visualization, something that was very important, and as I mentioned earlier, where this initially came from was including some sort of map. And the reason for the map is just to give an idea about what communities are being engaged within patient-oriented research and what's actually being done throughout the province. So what we would ultimately like to include is having some sort of interactable map that's ultimately linked with our database. So depending on what filters that you actually search for, is that different studies will show up accordingly. So if you're looking for, say, studies within the Fraser region, if I select on the Fraser region, then a whole bunch of patient-oriented research studies will pop up saying what's actually being done within the region, as well as some accompanying information down lower on the database. And we're envisioning that this filter system would be widely applicable. So if you wanted to search based off of a specific research topic, say just for it as an example, if we use breast cancer as an example, if I typed in studies about breast cancer, all the studies that are taking place about or researching breast cancer would showcase throughout the province and show what's actually being done. And our initial thought, at least for a filter, is to have our initial geographic location be based off of health authority geographical location, and then it would filter down further there with the hope that we can get, hopefully at the end of the day, identify which communities are being engaged in patient-oriented research and also see which communities have not been engaged. So throughout our consultation process we've been having conversations with different stakeholder groups. And one of those groups that we did have a conversation about was Reach BC. And one of the reasons behind this is they're doing something similar in terms of they're listing off different research projects, but they are searching for active study participants. And of course, based off of a volunteer study interest, they'll be matched up to a project accordingly and can also decide whether or not they would like to volunteer. And Reach BC has actually began posting patient partner research opportunities as well, which was something that I know for myself and our project team, we thought was really interesting. So through our conversation with them, and as we laid out what it is that we were trying to do, Reach BC was actually very open to the opportunity and the possibility of a collaboration between our platform and theirs. And so we've actually begun initial discussions with Reach about the possibility of what a collaboration between us and them would look like. And we're anticipating, as Reach currently does with researchers going and uploading their projects to the database in order to search for research participants as well as patient partners, in the future that while these studies are uploaded, they would actually stay and they would be closed and then showcased as like a living database. And we're anticipating that future entries would be included through self-submission, where studies must meet the previously included criteria in order to be listed onto the database. Brittany, is there anything else you'd like to add on about the Reach BC component?
I think basically I'll just add or just kind of elaborate on what you said, that for those of you who aren't familiar, if you might not be based in BC, Reach BC is kind of like a dating site to match up. That's kind of a way that we refer to it, to match up researchers with research participants or patient partners. So it's kind of got a specific lane right now. And what we're hoping to do and what we're talking to them about is expanding that to go beyond just having currently open recruiting research studies, to actually include all of these studies that already have found patient partners and participants and are operating. So yeah, just for those of you who aren't familiar, but otherwise that's it. That's all I wanted to add about that.
Cool. Okay. And so as we mentioned earlier, we were having throughout our consultation process, and as we were discussing with different stakeholders, a couple of suggestions came up and to how to make this database a little bit more user friendly, and as well as different ways we can expand upon this. So one component that was suggested was for us to possibly think about adding a knowledge translation column for researchers to update upon project completion. And this would hopefully encourage researchers to come and actually close the loop on their project. So if a study was intended to take, say, a year, and after a year, the ReachBC platform could send email reminders suggesting, hey, it looks as though the study has your study been completed? If so, would you like to upload your findings to the ReachBC platform, and as well as list off of how the patient partners were engaged throughout the study. And another piece that came up, and this goes back to more of a collaboration opportunity for patient partners, and something that was suggested to us through our discussions with regional centers was possibly including something along the lines of a community of practice or a forum as an avenue for patient partners to voluntarily connect with each other and share their experiences about their time on research projects. And this came from an ask that hopefully that we can have this database serve as a form of creating collaboration opportunities between patient partners. And we thought that this was a really interesting suggestion, to have an area where patient partners can voluntarily go and discuss with each other about their experiences. So in terms of our timeline, we're hoping to begin populating this database beginning of November, with user testing coming up about middle of January, and our initial launch was about end of February. Now, granted, this initial timeline was created in advance of our collaboration with Reach, so these dates are likely to change now that we are moving in that direction of a possible collaboration with ReachBC. So, however, we are looking to have an end of March launch date, regardless of where our timeline goes. And now we've got some discussion questions here, just for all the participants to think about if they'd like to chime in on of course the Q&A or the chat box. I know I've been talking for a little bit now, so I'd like to open up the floor to whomever would like to ask questions or throw something in the chat box.
Thanks, Ryan. Yeah, as Ryan said, we've got a couple of discussion questions here just to start the conversation. But of course, if you've got any questions about anything we talked about today, or anything that we didn't talk about and you think we should be talking about, then definitely let us know, and you can put it in the chat box. And if anything comes up for you after the presentation and you think, you walk away from this and you think about it a little bit and something pops into your head, you can email us. I know on the next slide, when Ryan is able to change it, you can see our email addresses, and yeah, we would love to hear from you. We really want to get as much feedback as possible from our community and from future users of this database about what would be useful for you and what would make you come to the database and what would make you stay there. So I'm just looking at the chat box. I don't see anything yet. I'll give it a few minutes.
I think we have one question here.
Okay.
From Dennis.
From Dennis. Yeah, so do you know if other inventories like that had been done elsewhere, like in Europe? Great question. So I don't know if anything's been done in Europe specifically. Oh, sorry, I minimized this and now I can't see it. So I don't know if anything has been done specifically in Europe, but I know there has been something kind of similar done in Ontario, and the tracking kind of report that was created in Ontario was something that was a bit more static. So basically the people that were involved in creating it took stock of all of the different types of organizations that were engaged in doing patient-oriented research just in Ontario, and put them into a report. And it was really informative. It talked about the type of engagement that was happening in all these organizations. So whether that's a university or a hospital or a non-government organization, community organization, et cetera, talked about what kind of engagement was going on there and what kind of research was happening. But it was static, and it was just kind of a snapshot in time of what was happening. What we hope for this database to be is more of a living, breathing thing that is updated continually, that people can come back to and update their projects and change the information that's available to make it current. And that's part of what Ryan was mentioning about our sustainability plan, and having it on a database like Reach BC that is quite interactive, and people can come there and add their studies and change them. And yeah, we can kind of get a better ongoing picture of what's happening in the province. So thanks for your question, Dennis. Anyone else? A second here in case anybody's typing anything. And I should mention that, oh, Dennis, do you think it could be easily exported in other provinces? That's a good question too. I think that it could be something that other provinces could definitely model off of. I know that the platform that we're thinking of using is a custom built platform that I was just about to say is also supported by the BC Support Unit. Reach BC is a support unit project. So, I mean, it's a custom built database, which makes it a little bit more complicated, not as easy to just copy and paste. But I think the concept is something that can definitely be transported and to other provinces and built upon. And of course, we're definitely open to collaboration and open to talking to anyone who might be wanting to learn from the process that we're going through right now. Okay, another question. So what would researchers get out of this and that would warrant spending staff time on updating their projects in the database? And thank you so much for that question. And that's something that we are thinking about. Really, we're taking a lot of time to think about that question right now. We are really hoping that this becomes a place where we can showcase, where researchers can showcase that they are in fact engaging in patient-oriented research, and that they are a part of this community, and that it's desirable to be a part of this community. I know that it does take extra time, and it's another form to fill out and all of that, but the idea is that eventually Reach BC, which is a place where people can recruit participants and patient partners, would build up its presence a little bit more, where more and more people are using that platform to enter their studies into it, to do their recruitment. So that initial piece of data collection for the database would actually be in that form, where researchers come to fill out the information about their study and say, we're collecting this kind of, or we're doing this kind of study, here's all the information about it. We're looking for these kinds of participants for patient partners. And then that data would just be transferred over to our section of the database, with kind of a follow-up at the end to say a couple of questions, like how many patient partners did you have in the end, and how were they engaged on the project? So we're kind of trying to mitigate the amount of work that researchers would have to do in that sense. But yeah, that is something that we're wondering about, and we are taking some time to think about. We're going to be talking with some researchers, and if there's any researchers on this call that have any input for us, we are going to be consulting with some academic researchers to see if they have any suggestions for us. Have you considered having researchers consent to having specific fields pulled from the Ethics RISE system to reduce having to duplicate the effort for research staff? Yes, and that is something that we've chatted with research ethics BC, or we are in conversations with Research Ethics BC. I think that's something that we could probably talk with them about. I know that that has happened in the past for other databases of research, such as the COVID research database that is being housed at the Academic Health Sciences Network. So it's been done in the past, and I think that perhaps this is a route that we could go. We do want to reduce the burden as much as we can on research staff and make sure that this isn't just another thing that people have to fill out, because we know that if that's the case, it probably won't get done. So we definitely are going to look into as many options as we can. And thanks so much for those questions. Anything else from anyone, or have I answered your questions sufficiently? Do you think you can add patient partner and searcher evaluation performance measurement of the project? What went wrong or good? Thanks, Dennis. Yeah, so I think that is something that we've been talking about, is how we can evaluate the project as we go along. And we will be doing some user testing with some key users sometime around January, hopefully, depending on kind of the timeline of when we end up ready for that stage. So we hope to do user testing kind of in the middle before we do our official launch. And then once it's actually launched, we do want to build in some kind of evaluation process to make sure that this is a database that people want to use, that it's actually doing what we hoped it would do. So we're still kind of in the very early stages of thinking about that. But as we figure out actually where the database is going to live and what it's going to look like, we will be working with, there's an evaluation expert at the BC Support Unit, and we'll be talking with him about how we can best approach evaluation for the project. So we will be doing that. Thank you. Thank you for that question. Anything else from anyone? These have all been such great questions, and really thank you so much for taking the time. Okay. I know that we've got someone on the call right now named Victoria that had emailed me. And she asked if she could have a minute or two just to chat with the group about something that she's working on. So she's the patient involvement, I'll let her introduce herself, but I believe she's the patient involvement lead for the Canadian Medical Association Journal. And she's asked if she could just have a minute to talk about the work they're doing, and I would be more than happy. It's such important work. I would be more than happy to give her a little bit of time to chat about that with you today. So Brian, if you wouldn't mind just flipping to her slide, please.
I can definitely do that.
And Victoria, I've unmuted you so you could speak.
Perfect. Thanks so much. Can everybody hear me?
Yes.
Yes.
Perfect. So first off, thanks so much, Belinda, Brittany, and Ryan, for giving me a couple seconds of your time. I think this is such a great initiative, and it's really cool to see everyone in Canada kind of coming together about patient-oriented research. And in particular, I just wanted to mention to everyone on the call that, as Brittany mentioned, my name is Victoria Sagal, and I'm the lead of patient involvement at the Canadian Medical Association Journal, which you may also know as the CMAJ. And that's a general medical journal in Canada that publishes research, clinical practice guidance, reflections on care, commentaries, analyses, guidelines, podcasts, all sorts of stuff, all about healthcare in Canada. And in particular, we're in the process of developing a patient engagement program with patient partners. And one of our goals with that is to include patient perspectives in everything we do. So given that I'm sure many of you on this call are interested in patient partnered work or potentially doing it yourself, I just wanted to let you know that we are looking for more submissions from authored by patients or co-authored with patient partnered teams as well as articles from clinicians and researchers that discuss aspects of the patient perspective in healthcare. So if you are interested in submitting your work on these subjects to us, we would absolutely welcome it and love it. The URL for our website is up here, cmaj.ca, where you can find submission guidelines and instructions, and my contact information is also there on the screen. We'll be officially launching the program later on in the year, but just wanted to let everybody know to keep an eye out for it and keep up the good work. I think it's really great to see everything that's happening in Canada right now to include patient perspectives in your work.
Thank you, Victoria. So great to hear from you, and so great to see this work that you're all doing at the CMAJ. It's so exciting. I know that lots of folks at the BC Support Unit will be really excited about this, and can't wait to hear more as it develops.
Yeah, absolutely. Thank you.
Yeah. So Ryan, if you wouldn't mind just flipping to our contact slide. So we are still in the process of doing consultation work such as this. So please, if anyone's got any questions, like I said, if anything comes up for you, any comments after the fact. I know this isn't necessarily the greatest format to have a discussion. So again, thanks so much for all your questions and feedback. Please send us an email. We're available anytime and would love to chat with you. And otherwise, keep an eye out for the launch of our database, which will be coming sometime in the spring. And we would love to have you stop by, and you'll see probably something in the BC Support Unit newsletter with more information about when it's launching and when it's ready for you to check out. So thank you so much. And Ryan, do you have anything else you want to add before we're ready to close?
Not really. Just thank you all for taking the time out of your day to be here and listen to us tell you about our project. I know Brittany and I really appreciate all the questions and comments. And as Brittany said, feel free to reach out to either one of us if you would have any questions or would like to chat further about the project. I know we really appreciate it. So thank you all very much.
So thank you everybody for joining us today, and just a quick update to check back in on our YouTube page for the recording of this if there's anybody else that you'd like to share this with. So thank you again, Ryan and Brittany. Bye everybody.
Thank you. Bye.
Thank you.